Hello, my name is Julie Webster. I am a manager for speech-language pathology services at the Children's Developmental Health Institute in Portland, Oregon. Working as a pediatric speech-language pathologist has been enormously rewarding for me. During my career, it has been my pleasure to work with families to help their children communicate. Communication is a dynamic process that begins to develop well before we even hear our children use their very first words. Communication starts very early, as soon as babies develop a purposeful intention in their behavior, such as a desire to be held or fed. This is noted in their different kinds of cries, facial expressions, or gestures. Before first words emerge, children watch people closely. They watch them sharing attention, and children listen to the voices of others. They are learning to take turns in play with their eye contact and their sound usage. As children listen to us, they begin to learn that when people are speaking, they use words that have meaning. After acquiring what we call early prelinguistic skills, children begin to produce words. We have come to expect that these words are almost always preceded by ample vocal play and speech practice, also called babbling. Having acquired some vocabulary, their next step becomes word combinations, phrases, and later the expression of a sequence of ideas. During this time, children are also setting about the task of refining the precision of their speech sounds for more and more speech clarity. So we've talked a little bit about how communication develops in children. So how do you know if your child needs help? Concerns begin when children are not meeting their early milestones. The following provides guidelines for when children should be seen by a professional. At greater than 18 months of age, children who are not yet using communicative gestures, such as using their hands to reach for things, grab for things, waving hello, children that are not responding to others' voices by turning their head, looking, and smiling, or not producing single words, or those who have a generally limited vocabulary should be seen. At greater than 18 months of age, children who are not yet using communicative gestures, such as using their hands to wave or to reach for things, those who are not responding to others' voices by looking and smiling, and children that are not yet producing single words or have a generally limited vocabulary. At 24 months of age, a child who uses fewer than 100 words, does not yet use two-word combinations, such as ball bounce, or uses language for a variety of purposes, requesting, protesting, commenting, and speech that is not understood more than 50% of the time. At age 3, a child who is not yet using multisyllabic words, such as banana, or a child who uses few multi-word combinations, does not ask simple questions, or seems to echo or parrot speech often, or whose speech is less than 75% clear, should be seen by a professional. At age 4, a child who has difficulty following directions or who has difficulty using pronouns, uses telegraphic sentences, or has a limited variety of vocabulary. Also, we expect that a child's speech should be almost completely understandable. Greater than 95% of their speech should be clear. The child's speech should almost be adult-like by the age of 4. If you think that, based on this information, your child is not meeting those early communicative milestones, who should you see for help? Certified speech-language pathologists are trained in communication sciences. They are specialists in speech and language development and evidence-based interventions. Speech-language pathologists are also trained to value family-centered approaches that honor cultural diversity. Parents and family members have valuable insights into how their children learn and communicate, which should always be included in the process of developing communication skills.
Right.
Pediatricians, daycare providers, preschool teachers are all people that have insights into a child's development, and they may make a great resource in making referrals for services.